friends, this is Kathy and welcome back to my channel. Let me just make sure that we are focused on the camera. I think we are good. All right, it is 7:59 Central Time, August 21st, US time. So we're just waiting for a few more friends that will log on. And we will go ahead and get started. Just one more minute. All right. So today is very exciting. We are going to be talking about how to become a caregiver in year 2020 during COVID times. So as many of you may or may not know, I am a registered nurse here in Texas. And I just want to talk about my experience as I, have my in the nursing field, working with very talented and very dedicated caregivers. So I just want to talk about that, and hopefully by the end of our session, you'll get to know if caregiving is the career for you, or maybe someone that you know, or maybe not, or if you're thinking about having a, going through a caregiving career. So I see some of my friends are logging in. Hi, Bree. Thank you so much for logging in. So I think what we're going to do, good morning, John. Thank you so much for logging in. So I think what we're going to do, so I'm just going to go over our topic for today, and then I'll go ahead and go back to the chat column and check and see if there's some pertinent questions there that I can answer on our session today. So if you are new to my channel, make sure that you go over all my videos. I cover Harry Potter stuff, lifestyle vlogs, nursing, and this is the new gig that I found out is I'm going to be doing live stream every Friday, 8 o'clock Central Time, US time. And if you are in the Philippines, because I'm from the Philippines, if you're in the Philippines, it's going to be Saturday, 9 o'clock in the morning there. So make sure you better wake up so you can catch our live stream, and you can go ahead and get some questions out there in the chat. Other than that, you can go ahead and replay the video. It will be posted publicly on YouTube. So here we are. We're going to be talking about caregiving, caregiver. Let me go ahead and pull up some of my stuff. I think next time I'm going to go ahead and I think it's Yard Stream. So I have the stuff here that I prepared, and I'm going old school. So let's go ahead and first define what is a caregiver. Okay, so I'm going to go ahead and put that on the side. According to Google, caregiver, caregiving is providing care for the physical and emotional needs of a family member or a friend at home. Caregiving may involve assisting with meals, personal care, and transportation, help with medical procedures, and therapy. So I think that is a broad definition of a caregiver, and we use that traditionally. I think it can be used, or it's mostly used, as a caregiver within the family structure. So if a family member has been debilitated and that family member needs some caregiving, then you have another family member that's physically able to do that task for you. But from the medical field industry, caregiving means you get employed, you get some training, you go ahead and work in a facility, work in an institution, work in a hospital setting, or maybe be hired as a personal caregiver and get a direct employer, and that employer will pay you as a private caregiver. So there's so many different aspects, right? So let's talk about education. Okay, education. Is that okay? A piece of paper and wording there. So education. What do you need to have as credentials to be a caregiver? Technically, here in US, you don't really have to have some type of certification to be a caregiver. So if you want to be a certified nursing assistant, which we will not talk about tonight, but I may go ahead and brush through, and we'll go ahead and talk about it later on at the end of the live stream if we have enough time. But being a caregiver, you don't really need, oh, I'm moving the camera, I'm moving the computer, hang on. But being a caregiver, you don't need to have a certain type of certification. You don't have to have a degree. You don't have to have some kind of an associate's degree or anything like that. Basically, what you just need to have as a caregiver is a good heart, and that you're on the go for it. You're okay with the job, and that you are there to help out people. So that is basically just what you need. However, it depends if it depends on the company that you're going to be working for, right? Because they need to provide some training. Like for me, I work in an assisted living company, and we can't just hire somebody that was working at McDonald's or Wendy's or whatnot yesterday and then come to us and wants to work in assisted living, where you have to take care of residents, of elderly people, right? So if we like you, because I'm an employee, so if we like you, then and you qualify for the job supposedly, then we will go ahead and provide some training for you, and that way you are equipped to take care of residents in the geriatric population. So basically, like I said, as a caregiver, you don't really need to have a special training. You have to have the right heart, the right mindset, and that you are ready, physically ready to go out there and conquer the world and take care of people that are in need of your help. So let's talk about training. Thank you so much for those of you that are logging in. I will go ahead and take on some questions that you may have. Continue to go ahead and put your questions on the chat box, on the chat column, and I'll go ahead and scroll up and take a look at those questions and address them in a little bit. So training, okay? Oops, there you go, training. So when you get hired as a caregiver, the company, like I said, the company depends if the company is big or small. If it's a small company, it depends on what they have, but typically, and not really typically, but they should have training lined up for new caregivers that are coming on board, right? So what would that training look like? It depends. So if you are working for a hospital setting, they would call you personal care assistant. If you work in an assisted living industry like where I work, then it's either you're called a resident associate, care associate, or a staff member. So it depends on the company that you work for. And also it depends on the regulatory services or regulatory restrictions that company needs to follow. For example, I can only cite an example from the assisted living standpoint because I work for that industry. So for assisted living in Texas, we follow the regulatory services for the state of Texas. So for Texas, you need to have, I think it's 4 hours basic training. Okay, that is like a classroom type training. And then you need to have 16 hours of OJT, on the job training. Now, I don't think 4 hours of basic training, computer training, paperwork training is good enough. So I know with the company that I work for, they've extended that to actually 3 days of some type of a classroom training. Learning management, it's actually called, what do you call this? Computer training, different types of modules. And then after that 3 days, you also have that 2 days of OJT. Basically, you need to follow a caregiver and shadow a caregiver that will train you to do the job when you are released on the floor by yourself, right? Some of the things that they're going to be teaching you, okay? ADLs. ADLs stand for activities of daily living. So basically the little things that we do, like from getting up in the morning, going to the restroom, brushing your teeth, washing your face, getting dressed, maybe showering, toileting, things like that. Those are the ADLs. So that would be the number one thing that you're going to be trained on how to assist somebody with ADLs. Mind you, if you work for an assisted living or in a hospital setting, then you will have patients or residents there that have some type of cognitive decline, somebody that may have some type of confusion or dementia, and that they may be able to physically do the job, but they cannot remember what they need to do, like the sequencing of, putting your toothpaste on the toothbrush. And then what do I do next? I don't remember what I need to do next, right? And that's the part where the caregiver will help that resident to cue, okay, Mr. Smith, after that, you go ahead and put it in your mouth. And maybe you can even do some motion to kind of jumpstart their brain, their mind to, oh yeah, after putting the toothpaste in the toothbrush, I got to put it in my mouth and brush my teeth. So those are some of the ADLs that needs to be, that is part of your training. What about transfers? This is very controversial. Transfers, that is very important that you are trained properly on the mechanics of transferring somebody. I have worked with caregivers, or so itty bitty petite caregivers, and they can transfer somebody that's about 250 to 300 pounds easy, like a piece of cake, right? Well, I wouldn't say a piece of cake, right? But they're able to do it effectively. You want to work smarter and not harder, right? So that will be part of your training. There's a particular part of body mechanics, the way you position yourself, the way you maneuver, are you going to be on the right side or left side? It depends. So you're going to be trained on how to do that. Is it going to be a one person or a two-person transfer? So those are some of the things that that you will be trained on. How about infection control? That is very important. It's we are in the unprecedented time. Can't say enough about COVID, but infection control is very, very important. Pre-COVID, infection control means you're washing your hands all the time. You're washing your hands every other patient or every other resident, right? So you got to make sure you are doing that. You know the importance of completing your infection control before you go on or before you move on to the next patient or the next resident. Long nails is part of that. Over here in the United States, the people wear those long, super, I don't know, I'm just not a fan of them. Long, super pointy nails and with beads on them. You cannot have that. You can cause a skin tear if that's what you have. So it'll be on the employee handbook anyway that you are not supposed to have artificial nails. Let's see. Feeding assistance is also important. There's a technique. You have to have that compassion when you're assisting somebody with feeding, right? There is a technique. If you are working with somebody that has dementia, we like to use the term hand over hand. I don't have a spoon here, but basically you need to help that resident, that patient, to have that motion of feeding themselves, not just feeding them directly like a toddler. You have to jumpstart the brain into that motion of putting food in their mouth. So there's different techniques to do that. Oh, I don't know if it's a lot, but maybe one or two techniques to do that. But the main point of that is being patient. Caregivers may become impatient especially if you work in a facility, if you work in an institution, right? Caregivers may become impatient if they know that they have to feed another person there. And the easiest way to do it is maybe group them together and start feeding them like toddlers in a round table, right? So there is a technique to how we can do that, maintaining the resident's dignity. All right, what about documentation? Okay, so part of your training may include documentation. And what are we talking about documentation? What are we documenting, right? We're not asking you to document the whole day narrative of what you did during your shift, but maybe simple documentations of ADLs. How many times did the resident go to the restroom? How many times did the resident had a bowel movement, right? Or what was the percentage of their food that they consumed for lunch and dinner and breakfast? So those are the type of documentations that might be expected of you. If you work in a smaller type of a company, then they may ask you to even do medication assistance, right? So it just really depends, but you will be trained. There's no way that a company, however small they are, should put a new caregiver out on the floor without getting properly trained. They deserve to be trained and to be equipped with the tools and knowledge and things that they need to have so they can take care of the residents, they can take care of the patients in a safe manner. So those are some of the things that I can think of. It might be more than this. Yeah, it might be more than this. It depends on the company. I think for us, there's more like HIPAA violation, privacy, confidential, process, making sure that we are not talking about the resident's care in the hallway with another caregiver when a family member for another resident is passing by. You cannot just discuss patient care or resident care information in the hallway or publicly. That is a HIPAA violation or a breach of confidentiality. So you don't do that. You know what? One of the big things I want to talk about, and also like bloodborne pathogens, things like that. So what would you do if you see a spill of blood on the floor? How are you going to clean it, right? Also, I would say that dignity is very, very important. So, like for us, with the company that I work for, for the company that I work for, I got your question, Bree. I'm going to go back to that one. So for the company that I work for, I'm repeating myself 3 times now. I lost my train of thought. We train the caregivers to communicate with the residents with respect and giving them their own right, because there's what we call the residents' rights, that if they don't want to eat at 8 o'clock in the morning because they're not a morning person, like I'm not a morning bird, so I'm probably going to eat like 9:30 in the morning when I get old, right? So if they don't want to eat at 8 o'clock in the morning, then they have the right to eat at 9 o'clock or 9:30 in the morning. It doesn't have to be too institutionalized. Well, this is the time that we serve breakfast, so you got to eat at 8 o'clock. It doesn't work like that. You have to respect the residents and the patient's rights, right? So you got to be able to adjust. So we do teach those type of things. Let me go back to a few questions here real quick. Bree asked me a question about having a degree to become a caregiver. No, very, very good question. I did address that earlier on. You do not need to have a specialty to be a caregiver. You just need to have the right heart and the right mind. However, if you've taken some classes before, of course, that's always a plus. If experience is really, really important, if you've had an experience as a caregiver, then you're more likely to be hired right away. But there's always a first time for everybody, right? So that first job as a caregiver will be crucial for you to the success of your caregiving career. But yeah, no, you don't really need a special degree for that. So there's another question here. How are the caregivers coping with the pandemic while they're on duty? Do they have a special protocol on exiting and re-entering their nursing homes? Yes, very good question, John. Very good question. That is very informational, very important for all of you to know that during pandemic right now, under COVID situation, each company is to follow the state guideline, the CDC guideline, their own company's guidelines. So state regulatory, we have the CDC and the company guideline. So the question is, we provide PPE. Each company should be equipping all the caregivers, all the medical staff with appropriate PPE. In the beginning, PPE is personal protective equipment. These are your masks, your face shield, your gowns, gloves, hair covers and shoe covers. In the beginning, I think it was like in March, I think we are kind of on a conservation mode. So we got to reuse our PPE, right? But I don't think we're on that stage anymore. We're good with supplies. So everybody has to be wearing their PPE. There's a lot of fears. I have colleagues or coworkers that, wouldn't want to go to a certain facility because they have positive cases there, right? But the key point is, as long as you're wearing your PPE, then you should feel a bit more comfortable. You will be exposed. Becoming a caregiver doesn't mean when there's a pandemic, you don't work anymore. Even for me, becoming a nurse, when there's a pandemic, that doesn't mean I'm not going to work anymore, that I'm not going to pull up my sleeves and take care of residents, right? I didn't sign up not to be a nurse when there's a pandemic. So everybody should be ready and mentally and psychologically prepared to do that. Do they have special protocol in exiting and re-entering their nursing homes? Yes. there is a screening process. When you come onto your job, you have to be screened. They're going to take your temperature and your oxygen level. It's a pulse oximetry. Oh, I can't pronounce it. Oximetry. They will take your oxygen level, and then you have a series of questions. Have you been exposed to someone? Do you have signs and symptoms, coughing, things like that? So that is a very good question. We do that for our company. I know everybody's doing that because it's a protocol by state and the CDC. So we do that upon entering the facility and also when you leave the facility. So very good question. All right, let me go ahead and continue. So training, we talked about training, and education is very important. Educating our caregivers in the amount of exposure to certain diseases, for example, COVID. There's also some that are, like bed bugs, that type of stuff, right? Or shingles, or sometimes you may have a resident that has HIV. So those kind of stuff, or other bugs in the body that you may contract because of exposure. So those type of informations are very important to get to the caregivers from the get-go in the beginning. And that way, nobody needs to freak out, but that's the reality of it. And that's why we're in the caregiving business, caregiving industry. So where to work? Where to work? Oh, is that right? Is that a right question? Where can you get a job as a caregiver? I think I have been mentioning this anyway. So as a caregiver, unlicensed, because there's another part, which is certified nurse aide. That's you call CNA, certified nursing assistant, certified nurse aide. That is separate from a caregiver. The CNA has to be certified on your state. So for the state of Texas, you have to be certified. You need to go through schooling. I think it's 60 hours of, I think, classroom training and 40 hours of on-the-job training, like a clinical rotation, to complete 100 hours of schooling and training. Then you're eligible to take the certification exam provided by the state, right, for the state of Texas. So we're not talking about that. We're talking about just a caregiver, where you don't need to have certification. You don't need to have that type of training as the CNA. So where can you get a job as a caregiver? So like I've mentioned, you can work as a private sitter for a family or somebody that you know, and they'll pay you directly. Remember, those type of, if you're going to be a private caregiver, I doubt that they provide any benefits. So there's not going to be insurance benefits like medical, vision, dental, maybe 401, But if you work for a big company, like for assisted living companies that do not really require for you to be a certified nurse assistant, then they offer those type of benefits. So yeah, so like assisted living, maybe independent living too. I know hospitals too. It was way back when I used to work for the hospital setting, they called them PCA, which is personal care assistant. Not all of them are CNA, but I know they've hired people that are non-CNAs to be personal care assistants, which can be under the caregiver bracket, right? So let me see what else. I think that's pretty much it, if I can remember correctly. If you want to be a CNA, the certified nurse assistant, the door opens up, more doors kind of opens up for you as far as where you can get employment. You can go to a skilled nursing facility, a nursing home, home health aide, hospice aide. Those are the opportunities for you if you want to go to the CNA track. But if you're just doing caregiving, it kind of limits you a little bit in some way, but there's also opportunities in that. And now we'll talk about that in a little bit. Good question. Let's see. All right, let me see. Oh, this is the next question that I see someone ask on the chat. How much money? Ooh, the $1 million question, right? With the amount of hard work that they do, if you are to work in a company, I know, and I looked it up in Google a little while ago, for Texas, the starting pay for caregivers are about $10 and some cents an hour. That might be like without experience, I think. I know there are some companies out there that will offer a little bit more than that. And I'm not talking about a whole lot more, maybe like $1 or $2 more, maybe like $11, $12 per hour. And some may also have a differential, which is if it starts, I think it starts at 6 o'clock or 7 o'clock at night, then you get an additional $1 or $2 pay on top of your regular hourly rate. Now, depending on which state you are, it may be a bit different. It might be a little bit higher depending on the standard of living. Like if you go to California, I'm pretty much sure the caregiving job there, pay rate may probably start off at $15 an hour to $18 an hour. I'm not sure, but everything there is expensive as compared to Texas, right? Everything here is a little bit more affordable. So I think that is it for the pay. I hope I answered that question. All right. What about opportunities? Okay. What does it mean by opportunity? What do I mean by opportunity? So remember, I kind of gave you guys an example of the CNA, right? The certified nurse assistant. You have so many avenues that you can go and you can work for, right? You get more training, more in-depth training. But with a caregiver route, you are kind of limited, but there's also some opportunities. I will tell you that for the company that I work for, it's an assisted living, right? You come on as a caregiver, you do a great job. You shine, your annual performance is awesome, and we see you, right? We see you shining, performing. We have a program in the company that I work for. We have a program called delegation program. So that is like a promotion type where we will train you to pass medications. So now you're coming into the level of med tech / medication technician / type of charge nurse type, right? Let me just drink a sip of water. So you're entering now a different world because now we're going to train you. You're going to be like a charge nurse on the floor. And that's an amazing, amazing program. Not all companies offer that, but I'm just telling you the opportunity that are out there for caregivers. So what would that look like? Well, you get a little bit more of knowledge. We will train you on pharmacology. We will train you on medication pass. We will train you on some of the basic, most common disease process for elderly people. And you'll get to know the medications that are needed to maintain or to regulate those disease process, right? So it gives you a little bit of oomph. It gives you a little bit more of, wow, I'm a med tech now. I'm no longer just a caregiver. Or, in addition to being a caregiver, in addition to being a star caregiver, I am now a med tech as well. So that is one of the great, great opportunities that you can get because certified nurse assistants are not allowed to pass meds. They're not allowed to give medications if you work for a company, right? Because that's going to be against the regulation. So they're kind of limited now on that part. But as a caregiver, as long as you've shown your A+ performance in the company, then you can get trained to be a medication technician. So that is the greatest opportunity that I think that can be offered to caregivers. Now, let's talk about hard truth. What are some of the hard truths, heartaches, and just a bunch of different things that you will experience as a caregiver? Personally, I have never been actually a caregiver. I went straight to nursing school without thinking much about it, right? Because I'm from the Philippines and a lot of the Filipinos are nurses. So when I got here in the United States, everybody's a nurse. And I'm like, whoa, okay, what do I do? I worked for a call center, I think, at that time. And so, let me go ahead and go to nursing school and see what the hype is all about, right? So I've never been a caregiver. But if you're a caregiver right now, it gives you a big push. It gives you a big advantage. Should you proceed or should you advance your career in nursing into an actual nursing school program where you can be a licensed nurse? So I think that's a good baseline foundation for you. I've never been, so I didn't get to experience those kind of stuff. But I would tell you that I work with the most dedicated and compassionate caregivers in the industry. So some of the things that I've noticed with them is that, as a caregiver, you get to develop relationships with your residents, with your patients. If you work in a hospital setting, your patients are there maybe like a day or 2 or 3 days, and then that's it. Then you get a new set of patients, right? But if you work in non-acute care setting, like assisted living or independent living or the private setting or home care or whatnot, then your residents, your patients are your patients forever and ever, amen, right? So you really develop that relationship with them, and they become they become your extended family. And it's heartbreaking when they become debilitated and then eventually pass away. So it is rewarding as a caregiver to be taking care and knowing that you are making a difference in someone's life. That is, I think, the most rewarding part of being a caregiver. Hardships, I will tell you. Hardships. Okay, so if you are working with a patient, like on a one-on-one, there can be some family dynamics. So that's the part where you're like a pickle, you're like in the middle of everything, and you're trying to, appease a family member against a family member, or maybe two sons or two daughters. The siblings are fighting over their father or their mother, or whatever needs to be done. So you're like in the middle of everything. That's one of the hard truths about being a caregiver if you are taking care of a patient one-on-one. Now, if you work for a company, then it can become combobulated, right? Because not only that you're dealing with family members like that, now you're dealing with your supervisor. Now you're dealing with another caregiver. Now you're dealing with, med techs and nurses, things like that. So there can be different types of dynamics in that facility or in that institution, right? Some probably may not like the way you perform as a caregiver. There's too many expectations. You didn't do this, you didn't do that. Families complaining, So there are a lot of things that are out there. So you have to be, not only that you have to be physically strong to take care of your resident and mentally strong to take care of your resident, but also just emotionally strong to fight or to be ready, to be prepared when you're dealing with difficult people or difficult coworkers, difficult family members, right? So those are some of the things that I've noticed. But as far as rewarding, it is rewarding. Some residents that if you have a resident that passed away, it can be heartbreaking. And I've seen caregivers cry, and we have to always offer some type of grieving assistance to the caregiver staff because of residents that have passed away. I do want to tell you that if you are starting, or if you're applying a job as a caregiver because of the COVID status right now, you probably will be required to be tested negative, and that way they can assure or validate that we are not bringing somebody that may have had an exposure or maybe positive and asymptomatic to the facility. So be prepared for that. And if you've, I think you can go ahead and get that scheduled anywhere. Just give me a few seconds. I think, yeah, you can go ahead and get the COVID testing scheduled anywhere if you just tell them that you are a caregiver and that you need to make sure that you are tested negative for COVID. If not, then the facility that you're applying for, once you're hired, may offer the COVID testing to make sure you're clear before you start your on-the-job training. So I think that is it. Let me go ahead and get to the questions if I have not addressed any of them. How do you like being a caregiver before and currently with the pandemic? So like I said, I've never been an actual caregiver, but as a nurse, I am a caregiver. So it's very rewarding. Whenever I go visit residents, I will tell you, because I work in a geriatric population, right? The elderly people. I will tell that they're most hungry with your time. The time that you spend with each patient, with each resident, is precious to them. Why? Because they're stuck there. They're stuck in the room, nobody to talk to. Everybody, everybody, the staff, they're all on their phones. They talk so fast. Their tone of voice is high pitched. They can't hear it. They have hearing aids. But if you take the time to sit down on the side of their bed and take that time with them and have that conversation, that you're willing to be patient and listen to them, that is the most rewarding thing that I think as a caregiver for me, as a nurse, as a caregiver. Now, with our current situation with pandemic, do you think I'll have the time to get with a patient or a resident and spend that good quality time with them? No, the answer is no, because CDC's guideline right now is make sure you're limiting your exposure to a patient or to a resident for less than 15 minutes. You have to be 6 feet apart and less than 15 minutes interaction, just in case I'm positive, but I'm asymptomatic, or just in case that resident is positive and asymptomatic. Yes, we do have residents that are positive and asymptomatic despite of their age and despite of their comorbidities. Just in case that they are positive and asymptomatic, I get it, and then I go back and work on the floor and pass it on to other people. So that's the only thing. That's the only sad thing right now. A lot of our residents are getting depressed because they're inside their room. We don't do activities anymore, social activities, because of the social distancing. So that is what's really hitting them hard. And they are becoming more debilitated, more depressed, and later on passing away. We've had deaths, unfortunately, and it's everywhere, and it is unfortunate. Okay, so let's see if there's any other questions here. Face shield showed very good protection level, meaning airborne transmission is not the main source. I'm not sure about airborne not being the main source, but the face shield gives you that good layer of protection. And if you have an airborne, like an air particle coming from somebody that's positive, hitting you in the face, but you have the face shield there, it deflects that, right? Okay, but you have to make sure that you're talking to that someone that's asymptomatic. Air particles are in the air, and your hands are there. The air particles are getting into your hands, and then you touch your eyes and touch your nose, maybe touch your mouth. There you go. I just don't know about studies on that. It depends on how much viral load you've contracted on the tips of your fingertips from the air, from the air particles and putting it in your mouth. I don't know if you're even going to be positive, for that, due to that process. I'm just not sure. But yes, face shield does protect you. So right now, that is actually mandatory at our job, and everywhere you go, you see people from time to time wearing a face shield. Last week on my live stream, I didn't have the better quality, at that time yet. But last week when I did my live stream, I went ahead and showed you guys the face shield that I bought from my friend, which is has a better airflow because it doesn't have that foam stopper here. I don't know what you call that, but it doesn't have that foam thingy over here. It has a better ventilation. All right, so let's see. What else do we have? How much do caregivers make? Over here in Texas, it's about $10 and some cents. If you have experience before, it may be $11 or $12 an hour. It just depends on your experience. But as a new caregiver, it probably would be around 10 and some cents. All right, so let's move on. All right, in California, it's $13.50 in California. That's right. It might be a little bit higher in other states and other places that have a higher standard of living. Yes, that is pretty. Yeah, in California, it looks like California has a union. I know Texas does not have a union, but a lot of states do. So make sure that you are familiar with that if you are getting into the nursing career industry. Has it been hard for you not to talk with them? Yes, it has been hard, because not only that you're not able to spend that good quality 15 minutes or more of time with them, not only that, you also have a mask and the face shield, so they can't really see your mouth moving, and you don't really get that good human interaction, right, without any barriers on the face. So it has been hard, and a lot of them are hard of hearing, so you have to talk a little bit louder on top of having a mask on and a face shield on, right? There's so many barriers. It has been crazy, but you just got to speak a little bit louder. That way they can understand you. In the facility that I work, it is recommended for the residents to wear a cloth mask at a minimum. If they have a surgical mask, they can go ahead and put a surgical mask. But it has been recommended that they wear some type of a mask whenever a caregiver is coming inside their room to provide services for them, just in case, also to protect the caregivers and also to protect themselves as well, right? So, okay, so what else? So we're still kind of early. It's only 8:39. I can go ahead and start talking about the CNA if you guys want that, the Certified Nurse Assistant. I'm just going to brush through real quickly. Like I said, for certified nursing assistants, you have to go through here in Texas 100 hours of training, 60 hours classroom training, and then 40 hours doing clinical rotation training. So with the clinical rotation training, you will actually go to different facilities and shadow another CNA on how to do, CNA tasks. And what would that look like? It would look like, CNAs work hard. I'm telling you, you are on your feet all day long. CNAs are mostly seen in a nursing facility industry, like skilled nursing facility, rehabilitation. And they are on their feet the moment they get into the facility first thing in the morning. And we're talking about those places have a lot of bed-bound residents or bed-bound patients, right? And those places have heavy, heavy patients. We're talking about turning them every 2 hours, changing them. Have y'all heard of a Hoyer lift? Hoyer lift is an apparatus. It's a machine that will lift you up. So you have this mesh seat, like a hammock, like a mesh seat, and you're going to be rolled to the side and tuck that on the other side, rolled on the other side and tuck it on the other side. And then the Hoyer lift machine will pull you up. It has hooks on the corners of the metal framing, and it'll lift you up because you're unable to get up on your own. And we do that when we're sitting you up in a wheelchair, and then we're also going to the showers. Then that's how you are transported. So heavy. That apparatus, that machinery has to have 2 people operating that machine just to make sure that the other person is operating the machine safely, and then the other person is assisting the resident, make sure the resident or the patient doesn't fall off of that mesh seating, mesh chair, right? So CNAs work hard. They're on their feet from the get-go, from the morning, from the very start of their shift. And they could be training residents, assisting them with dressing, extensive total care, dressing and grooming, right? And also setting them up for breakfast. So breakfast, lunch, dinner. In between that, either you're giving them a shower or you're assisting them to the restroom or changing their incontinence products. Those are the things that you do. And it's just continuous walking all day long, all your shift. And that's what you do. And then after that, you also have some type of documentation that you need to do. How many incontinent pads did you change for this particular resident? Yada, yada, yada. So those are the things. But the opportunity, the doors are a little bit more than the caregiver side, right? So finding a job as a CNA can give you a bit more opportunity. So yes, you can work at a hospital. Yes, you can work in an assisted living facility, and you can get paid a little bit more than a regular caregiver. Yes, you can work at a home health agency. Yes, you can work at a hospice agency, right? What else? And yes, you can also be a private caregiver. Let's talk about home health agency and hospice agency. The types of patients that they have on those type of agencies are mostly either in a facility or in a home setting. So if you're a home health aide as a CNA or a hospice aide as a CNA, right? I wouldn't say that you choose your patients, but I think you have the ability to choose your patients because you travel as a home health aide or a hospice aide. You travel around and you go to your patients' houses, your patients' homes, and you provide care. When you get there, you do the same thing. You do the ADLs. You change them. You probably have to give them showers or bath or dressing and grooming. And most of the time, you only go to a patient maybe once or twice a week. So in a whole day, you may have about 8 patients that you need to see. Anywhere from 6 to 8 patients. I think 8 patients would be max. depending on where you live and the distance from each patient to one another. Because you got to map it all out to make sure that you're home at a whatever time you want to be home. Okay. You also have the flexibility to, if you cannot see this patient today, then you can call the family, let them know, can I see you tomorrow instead? But it just depends on the situation. So those are some of the opportunities as a certified nurse assistant. So I think, I hope I've given you enough information about being a caregiver, being a CNA, if you want to pursue that part. And like I said, you have the opportunity to proceed in an actual nursing career, like an LVN, licensed vocational nurse, or a registered nurse. At least when you go to the nursing program, you already have some type of clinical background providing care to patients and residents. So I hope this session gave you a little bit more of information. This is just a broad overview. It's still a little bit different when you actually work on the floor. You're going to have your own experience. You're going to have your own, built-in training mode, when you go to work. So it's going to be different for everybody. But for the most part, the information that I gave you is basically just the basics of being a caregiver. I do want to tell you that customer service is very, very important as a caregiver. It depends if you work for a private company, or not a private company, like a private person, you're privately getting paid as a private sitter, or you work for an institution. Customer service is very, very important. We have to be mindful of our actions, of our behaviors, of our attitudes. These people, the residents and the patients, are already deprived of their physical ability to perform things that they used to be able to perform independently without even asking anybody for help. So you, as a caregiver, coming into their room, coming into their home with I would say a bad attitude, is just not going to jive well. It's not going to gel in well. You're not there to get paid just to do task and leave, right? You're supposed to be giving care. You're supposed to be, the advocate for your patient, for your resident. So don't just go in there with the wrong mindset of, I'm going to go in there because I get paid good. Especially if you work as a home health aide or hospice aide, I think you get a little bit more pay than a regular caregiver in a facility. I think, I'm not just so sure, don't quote me on that, but don't just go in and go in because of the money, because of the pay that you're getting paid for. Like I said in the beginning of our live stream, as a caregiver, you have to have the right heart, you have to have the right mindset, you have to be compassionate at what you do, because at the end of the day, you need to do the right thing as a human being. You need to do the right thing as a caregiver, not because of other things. I think that's the main part. Even as a nurse, I would say that you don't go in as a nurse because you get paid. Nurses do get paid a lot, I would tell you that. But you just don't go into nursing field, into nursing career because you get paid a lot. You have to have the compassion. You have to do the right thing. You have to be the patient's advocate. Same thing for anybody in the medical field. So I hope that message is loud and clear. And if you have any questions about caregiving, about nursing, go ahead and put your comment on in the chat. I think if you go back to the replay, you'll be able to put comments on the comment section. I do want to tell you that August is nursing series. So I have committed myself to do live stream every Friday, 8:00 at night, Central Time. If you are in the Philippines, it'll be Saturday, 9:00 in the time that I'm spending with you, as I appreciate the hour of your time that you're spending with me. But August is nursing series, conversations with a nurse, ask me anything. Next week is going to be all about licensed nurses, how I got to this point, what you can do, some nuggets that you can get from me, how much you get paid, what do you need to do with your nursing career, and opportunities as well. And I think next week is the last week of August, and we're going to jump into September. And in September, I want to jump into, I've got it lined up in my little dandy notepad in here. September is going to be a series for marriage. Oh, I'm excited. Marriage is going to be September. Marriage for Dummies series. I am married for 19 years, going on 20 years next year. And I know that I can give you a lot of nuggets and good stuff about, about marriage. So there's a few more questions that came through. All right. So a question. It's I think this is more of a comment. It's just so overwhelming. My patient and her daughter always told me I am a blessing to them. That is the reward that I'm talking about, Jessica. That is the reward that I'm talking about. The reward doesn't always come in monetary, doesn't always come in money, but that compliment that you made a difference to someone is the reward for being a caregiver, that you are there, you're compassionate, you care for them, and you take care of them. That shows, that shows, because other caregivers will walk in, they're in a bad mood. They're in a bad mood. You can't even picture their face, but if you're there, if you have the right mindset and the right heart, it'll glow that you're there to help them out, because they can't do it themselves. They're not going to ask for help if they can do it. They need you. And that is a good reward. It makes my heart, plump up that, yeah, I can do it. I'm helping other people, and it makes you feel good. How long have you been a nurse? Is a question here by our good friend Bree. Good question. I have been a nurse for, I think, 15 years, 15 or 16 years. My first 4 years, I was working at a hospital here in Houston, working on the floor. I think the last year of that I was a charge nurse. So that's the time when I'm already transitioning my mindset into the management type of nursing. I got out of the hospital, and then I got a job at a skilled nursing facility in Houston as the director of nursing. And I pulled all my hair out with that job. Kudos to all the director of nursing there. And then after that, I came to assisted living as a district nurse. And I love what I do. And I've been with this company for a long, long time. Great question. I know, can't wait for the September series. If you are not married, that is okay. You're going to hear some stuff from me about, marriage and good pointers in the beginning of your first year, second, third, fifth year of marriage, and what that looks like. I can only share you the things that I went through. And I think we're doing pretty good, I think, as a married couple with babes, right? Yes, marriage is a cool topic. Hopeless for me. That is so funny. That's a cute, cute comment. You are amazing. You are amazing too. All of you guys are amazing. I'm just so grateful that you guys were able to join me on this live stream, that I'm so happy, because it's a live conversation, and I love this interaction. I will tell you that I have been talking from since 8 o'clock this morning. I work from home, and I have been talking on the phone since 8 o'clock this morning. So I am on the go. So as soon as 8 o'clock comes, I'm like, I'm going to go on live stream. I'm going to talk to people not from work, which I love to, I can't wait to hear from everybody. So please share, the live stream to any of your friends that you think would benefit, anybody that would want to interact. You guys can interact in the chat room, and also we can interact. So thank you so much for your time. I think we're going to go ahead and conclude our live stream for today. I appreciate your hour of time that you've given to me. I hope this gave you a little bit of break from your daily routine for today. And also, hopefully that was able to give you some pertinent information about caregiving and the caregiver world. So don't forget to I think you should be able to hit the like button in here. And if you have not been subscribed to my channel, go ahead and click the subscribe button, and then look at all my videos in my channel and just pick and choose which one you think is good for you, which one you think is going to be entertaining for you. Remember that I cover Harry Potter, lifestyle vlogs, nursing stuff, and now live stream every Friday at 8 o'clock Central Time. Thank you so much, my friends. Y'all take care, be safe, and God bless you all. Bye, friends.